This is the first in a series of interviews with eminent personalities. We'll be bringing doctors, scientists, writers. Today we have Dr. Cyriac Abbey-Phillips, a premier hepatologist of India, who is working as a consultant and physician scientist at Liver Institute and Monarch Liver Laboratory, Rajgiri Hospital, Alua, Kerala. He is also a clinical advisor and doctoral advisory committee member, Department of Cell and Tissue Culture at Sri Chitra Tirunal Institute of Medical Sciences and Technology. Good morning, doctor.
Good morning.
Welcome to the show.
Thank you for having me.
I would like to start with, you've often spoken on Twitter and said that there's a need to differentiate between the term quackery and pseudoscience. Can you elaborate on that?
Yeah, in simple lay terms, when you say quackery, it is fraud. So when you say pseudoscience, it's actually illogical. That is how we simplify it. So basically pseudoscience, an example is homeopathy. So in homeopathy, the principles of homeopathy is actually illogical, where they actually dilute a particular component to very low doses and expect it to have an action in the human body, which is illogical. That is pseudoscience. Quackery is something that actually doesn't work at all, and that is just promoted as a fraudulent treatment option. For example, a very common example is in North India, people give jadi booty, a concoction of herbs to treat cancer. Now, it doesn't work at all. So that is what actually quackery is. So pseudoscience can actually lead to quackery because of the principles involved, and even without any pseudoscientific principles, one person can actually promote quackery to sell a particular item or a product.
Okay. So can you call, so what exactly do you mean when you say alternative medicine? Is it possible to use the term alternative medicine?
Yeah, alternative medicine is correct. We can use the term medicine because medicine actually means the science or practice of preventing or treating a particular condition.
Okay.
So alternative medicine is actually, we can call it as a conglomeration of practices, even though there might not be any science behind it. So alternative medicine is a rightful term that we use.
Okay.
We actually use the term complementary and alternative medicine. So complementary used when you actually add on something. So your cancer patients are getting treated properly with chemotherapy. Then you add on some complementary support onto it. For example, some Ayurvedic or a homeopathic treatment along with it for management of pain or improving quality of life, stuff like that. That is complementary. Alternative is basically you actually don't give them the proper treatment at all.
Okay.
So the patient does not get a proper evidence-based treatment. Okay. Apart from that, he gets another type of treatment which has no scientific values behind it. That becomes an alternative medicine. So these are the most important two terms that we use in medical practice. That is not evidence-based.
Evidence-based. Okay. Can you elaborate on what is evidence-based medicine?
So evidence-based medicine is something that as modern, the layman calls it as modern medicine. But it is actually evidence-based medicine because we generate evidence for its use in a particular condition or a disease or a situation. On the other hand, generating that evidence will also give us safety of using that particular product or a practice. So in actual scientific terms, when you actually have evidence that something works, we should also have evidence that it is not going to harm. The problem with pseudoscience and quackery is that they prophesize that it works, but there is no statement regarding how safe it is for use. Now this is very important because if you have a disease where you can actually have a very effective treatment, but if that particular treatment actually causes more harm during that treatment, then it doesn't make sense. Very classical example is use of mercury. Mercury was used for a lot of things, in early 40s, 50s and everything. They used to give mercury drops for arthritis, mercury drops for fever, mercury drops for everything. But then they found out that mercury was actually causing more harm than actually giving more benefit. So at that point, they realized that no, this is not the ideal treatment. So they had evidence, even though there was some effectiveness or whatever they found out, they had more evidence to support that it was actually harmful. So that is where evidence-based medicine actually works.
Okay.
So that is patient-centric medicine. So you have evidence that it is going to benefit the patient, not benefit the doctor, not benefit the company, not benefit the hospital. It has to benefit the patient. Ayurveda, homeopathy, Unani, Siddha, you take any traditional Chinese medicine, any traditional medicine, they talk about holistic management, management of particular symptoms per se, but they don't actually look at the patient from a scientific point of view, which is why there is no evidence in it. Even if there is evidence, there is no evidence to show that it is actually safe. So which is why we as modern practitioners would always want patient-centric practice, and that is what evidence-based medicine is.
That is. Dr. Abby Phillips, you've done a lot of work on liver injury caused by alternative medicine. What is your journey from, being a doctor who was just practicing his, just doing his daily practice, to suddenly realizing that this was something which needed your focus, which was of public health concern?
Yep. So when I started actually my clinical practice, I mean that was probably late 2016, in the year 2016. So when I started off, my actual passion was alcoholic liver disease. Okay. And Kerala is the best place to work on it. lot of patients with alcoholic liver disease, and I wanted to study infections in alcoholic liver disease, something known as acute and chronic liver failure because of alcoholic hepatitis. These are very tough, difficult diseases to treat. So my concentration was to work on that, focus on that. But what I noticed was that I was getting a lot of patients who presented with jaundice, acute hepatitis we say in medical terms, acute hepatitis. And when somebody comes with acute hepatitis first time, you actually look at all the common causes for acute hepatitis, which is acute viral hepatitis, any prescription drugs, a lot of old world painkillers, a lot of antibiotics, anti-epileptics. These all cause jaundice and hepatitis. So when we actually worked up these patients from a common point of view, none of these were actually coming out positive. So there was no cause for the acute hepatitis. So that is when we started biopsying these patients. We started doing liver biopsies. So in the liver biopsy, the pathologist would always give us a descriptive, result. She would never, pathologists usually say it is, this is the pattern and this is the disease. But the pathologist was saying just descriptions and saying do clinical correlation. Now clinically we cannot correlate anything because we do not have anything clinically positive for these patients. So that is when we started asking these patients, the history in much more retrospect. Okay. Like the last 3 months, last 6 months, what was happening? What was your diet? What were the other medicines that you used? So when we started probing very deeply, a lot of them came out saying that they were using a lot of herbal products, Ayurvedic products, a lot of dietary supplements and a lot of stuff like that. Okay. And then this actually caught my interest. And what was actually happening was that these products are marketed as safe. It is available over the counter. Yeah. The patient actually did not feel the importance of telling the doctor about what he was taking because he thought it was safe. Yes. It is herbal, it is natural, no problem. So even if we ask them, what medicines are you taking? What medicines other than prescription drugs are you taking? They still will not disclose that they are taking herbal medicines because they think it's safe. Yeah. So because we were probing in this particular aspect, so we started talking about not just herbal drugs, we started talking about herbs. Yeah. Okay. So now I ask my patients, are you taking ashwagandha? Are you taking kiranilli? Are you taking this particular herb? So we are very specific in our history now. And we get a lot of these patients giving us history. Yes, they were taking a lot of these herbal products, herbs. A lot of traditional Ayurvedic practitioners were actually giving them a lot of lifestyle medicines. And once that came into picture, now we understood that there was a temporal relationship. That is starting of these herbal supplements and products and then the liver injury happening. So that is how we understand or diagnose drug-induced liver injury. Okay. So we cannot diagnose drug-induced liver injury at face value. We have to actually rule out all other causes and then say this is the point where the drug was started. It is because of this particular intake during this period this has happened. So we have tools to identify that. So that is what we call as RUCAM scale, causality assessment tools. So when I actually applied these particular algorithms, tools on these patients, almost all of them had probable or possible causes of herb-induced liver injury. And which is good enough for clinical practice to call it as drug-induced liver injury. And the biopsy was suggestive of different types of injury because they were taking different types of herbs and lot of multiple herbal drugs together. That is why the pathologist could not give us a proper answer to what was causing the liver injury. Now this we published in Indian Journal of Gastroenterology in 2018. So that was the first paper that actually linked herbal drugs, Ayurvedic herbal drugs to acute hepatitis and acute liver injury in some patients actually leading to death. severe herbal injury leading to death. What we did, we went one step ahead. We retrieved these herbal drugs from these patients. We analyzed them. So we have a lab which is approved by the Ministry of Forest, Environment and Climate. It is NABL accredited, very good sophisticated facility. And they actually looked at all these drugs, herbs, everything, analyzed them and found out it contained a lot of heavy metals which are actually liver toxic, and also a lot of other hepatotoxic agents which are organic and inorganic. And this is what was very important for us, because we could link these to the liver injury.
Okay.
And once this was published, there was a very good editorial written on it in the journal. And the editorial actually said, Ayurvedic drug-induced liver injury, it's time to wake up and take notice.
Okay.
That was the editorial headline. So at that point, a lot of patients who actually came to me, I found out that it was not alcohol, it was not prescription drugs or painkillers that was actually causing a lot of harm. It was actually this, a lot of herbal supplements. And this was the reason why I started working on this more. And after my initial work on acute hepatitis, I started looking at patients with alcoholic liver disease who are actually on these herbs, and found out that on biopsy, these patients did not have alcoholic liver disease. They had at the background, but the active injury on liver biopsy was actually herbal injury.
Okay.
And without a transplant, almost 80 to 90% of these patients died at 6 months. That was our second study. Third study, we looked at patients with cirrhosis. So cirrhosis patients will have to undergo treatment for life. So these patients are obviously, they have concerns, they are depressed, they have a lot of issues. And for such patients, all these holistic medicine, Ayurvedic medicine, these are all very catchy treatment options. So a lot of these cirrhotic patients who went for Ayurvedic treatments, they actually landed up with liver failure. And that was our third publication, which we published in Hepatology Communications, which is an official journal of the American Association of Study of Liver Disease. So in that we showed that cirrhotic patients who take herbals have a very bad outcome. Alcoholic liver disease patients who take herbals have very bad outcome. And even without any underlying liver disease, if patients take herbals and get herbal induced liver injury, there is a chance that these Ayurvedic herbals can lead to death. So this was the first and foremost studies that we did over the last 3 years. And that is how my interest actually started on this. Because more than treating the patients, educating the patients and their family also became a major duty for me. Because preventive medicine is the best medicine. You don't expect something to happen then try to take care of it. You have to make sure that it doesn't happen. So the whole point of doing this actively now is not just to treat patients, but actually to teach in general what I have identified and what I have taught myself through my experience. So this is what I'm actually doing at the moment.
Speaking about herbal and dietary supplements, could you tell us a bit more about the role they should be playing, and the role they are playing right now and the role they should be playing? Like, is there a place for these supplements? Yeah,
so herbal and dietary supplement industry is very different from the alternative medicine industry. Because herbal and dietary supplements don't come under drugs. They are either functional foods or dietary additions that are supposedly given to improve a health condition. For example, vitamins, they come under dietary supplement. Some botanicals, some herbal supplements like green tea extracts, they all come under dietary supplements. Even Chyawanprash.
Ginkgo biloba.
Yes, Ginkgo biloba, even Chyawanprash, that is promoted extensively, that is actually a dietary supplement. So they all come under that particular banner. Now the issue with herbal and dietary supplement is that you don't actually have to test them for safety or efficacy, because they are not drugs. You don't expect them to work as drugs. You don't expect them to treat any disease or prevent any disease. They are just utilized as an additional agent. Because this particular aspect is there, what marketers people who promote or market such agents do is they just have to get a license saying that it has been manufactured under good sanitary conditions, and they contain supplements and herbal and dietary supplements as per a particular law. So we have the FSSAI, the Food Safety Standards Authority of India. So they have given particular components can only be part of. So you cannot have steroids, you cannot have hormones, you cannot have any psychotropic agents as part of the dietary and herbal supplements. So if that comes in, that becomes a drug. So you avoid that, but then you can list vitamins, herbs, botanicals, you name it. Everything can be in that particular product, and you can market it as a herbal and dietary supplement without any clinical testing.
That's true.
this whole aspect is very different in USA. The US FDA actually wants the promoter or the person who markets it or manufactures it to actually give specific details on each and every component that is there in the supplement.
Okay.
Also the safety of the component. Now if they are going to use a new component, they have to run clinical trials to show the safety of that component, and only then they can use that component in that particular product. But in India, it's just you get a license to manufacture under sanitary conditions, and then you get a GMP certification, and then you can just produce it and then put it out in the open. Now the problem is there is no standardization of making this. So Chyawanprash made by one company will be different from Chyawanprash made by a local company.
That's true.
There is no standardization, and one Chyawanprash might contain adulterants, another Chyawanprash might contain contaminants. So this is what is actually harming the population. So if we bring herbal and dietary supplements to a more strict marketing policy, not just marketing policy but testing policy, then I think we can actually avoid a lot of herbal and dietary supplement related liver injury, which is actually one of the biggest causes of liver injury in the West.
Okay.
In Asia Pacific, it is actually complementary medicine, Ayurveda, homeopathy, traditional Chinese medicine, things like that. So herbal and dietary supplements, it is over the counter, anybody can go and buy it. It is promoted, marketed, even though you are not supposed to market it for any specific disease, people still market it for particular disease. For example, there are nutritional shakes available in the market where they claim that it can cure diabetes, it can cure obesity, it can cure osteoarthritis. You take our shake, you'll be fine. There are even nutritional shakes which say, if you take the shake, people can actually get pregnant. So people who are, women who are having difficulty in conceiving, they go behind these dietary supplements, unnecessary. And they actually spend more, probably get harmful effects out of it. And the regulatory framework is completely in tatters, if you ask me, in herbal and dietary supplements, which is very different from the Ayush related regulatory framework. That is totally different.
Even with chromium, you had some concerns.
Yeah, so chromium, small microminerals, these are all part of dietary supplements. So chromium actually has been promoted for, without any actual scientific evidence to it. There is very weak evidence to show that chromium actually is helpful in diabetes. Chromium can actually decrease weight. It is actually a good weight loss agent. It can actually be given in women with polycystic ovarian disease and all that. There are a lot of review articles, very weakly done studies, poor methodology, and actually large systematic analysis and reviews have shown that chromium actually has very less value in these disease conditions. But even then, because it is a dietary supplement, people market it. And we recently had a case where a patient was consuming, a young woman was consuming supplements containing chromium picolinate, where she actually developed severe liver injury. And when we actually analyzed that particular sample for chromium, it was mentioned the chromium content was 200 microgram in the tablet on the package. But what we identified during our analysis was that it was actually more than 750 micrograms. So there is no standardization. What is written on the packet is what is not inside. So this is another major issue with herbal and dietary supplements, which is mislabeling. So they do a lot of mislabeling. They claim that something is inside which might not be there, and whatever they don't actually claim might actually be there. This is very important because there was this particular dietary supplement known as Hydroxycut. Yeah. So there is one called Oxalite Pro and one called as Hydroxycut, which is that was for weight loss. It was currently banned in the USA because they found out that Hydroxycut actually contained ephedra. So there was a lot of ephedrine in it, which actually led to high blood pressures and strokes and things in patients who are using it. Now they did not actually mention the dosages and everything of ephedrine. It was actually not provided on the label, so it was mislabeling, and they identified it and they took care of it. Another is something known as Oxalite Pro, which is also actually given for weight loss. So initially what they did was Oxalite Pro, they had a lot of weight loss supplements like sibutramine, which is actually banned by the modern medical community because it causes a lot of cardiac events and brain events, side effects. So it is stopped. So what they did was they substituted it with a herbal supplement, and that is known as Ageline. Ageline is basically bale fruit. Yeah, it's known as a bale fruit, which is very, very commonly used for Ayurvedic medicinal purposes. So bale fruit contains Ageline. So they used a synthetic version of Ageline in it for weight loss. That actually is one of the most liver toxic agents ever. So patients who consumed oxalate, they actually landed up with liver failure. This was also identified by the US FDA and they stopped production of that particular product. But I don't think even somebody in India develops something like that with herbal and dietary supplements, we will actually identify it.
Yeah, okay.
One is patients don't tell us that they're using these supplements. Two, clinicians don't ask the patients if they're using the supplements. And three, I think the whole regulatory framework is very flaccid. They don't actually care about any of the supplements that are in the public health. So this is one very important aspect of herbal and dietary supplements where there is contamination, mislabeling, and also use of additives and components which are actually not scientifically proven to be safe.
Okay. So when we talk about liver injury caused by these by alternative medicine, so is it the ingredients, the composite, the ingredients that form the composition generally, or the contaminants that are causing more the liver injury?
It's actually both. So if you take an example of aloe vera,
Okay.
so you have some products with aloe vera. Aloe vera is inherently liver toxic. Aloe vera can cause liver injury. So aloe vera is one of the reasons for a particular liver injury being happening. And we have actually identified and we have published it also on aloe vera. And a lot of case studies are there on aloe vera causing liver injury. Now in some instances, you take the example of milk thistle, that is Silmarin. Lot of gastroenterologists, physicians prescribe Silmarin for liver disease. Now Silmarin per se, if you actually look at all the data, it's very safe.
Okay.
But it is completely without any effect. So it's like a placebo. But people still give it because it is safe. Now in some instances, it might not be actually Silmarin which is there in that particular product. It might be something that actually is sourced differently. So they might think it is Silmarin, but it is not.
Okay.
So there is a contamination.
Okay.
Now even the Silmarin, that particular milk thistle where they are actually sourcing it, that particular environment might be contaminated.
Okay.
The machinery where they're making it might be contaminated.
Okay.
So all of this adds contaminants. That is how heavy metals come into the product. And this can also cause liver injury. So it's both ways. The product component directly can cause liver injury. Contaminants can also cause liver injury. In some cases, when there is both, it can cause really bad liver injury.
You've done so much extensive work and often you get trolled very heavily on social media and all. And you've also spoken about the pushback received from various quarters.
Yes.
So what are the hurdles you've faced in this line of work?
Yeah, so I'll be very open with you in this matter because this is actually what I have faced. So when the first study on Ayurveda herbal liver injury came out in 2017-18, and this was actually spread really wide and far on social media, on WhatsApp and Facebook and everything. A few months down the lane, I get an email from the Ministry of Ayush.
Okay.
And they have, initially they have said that, we have seen this, we are concerned about these findings and stuff like that. Then they started asking me to prove myself. That it's a peer-reviewed publication.
Yeah.
It's already proven, it's peer-reviewed and it is published in a very good journal which is actually run by one of the national societies. Still they were asking me for proof. How did you prove it? How do you say that this is caused by Ayurvedic herbals and nothing else? So, everything is there. I told you how the methodology works. We've done everything, still they were asking for proof. So I said, see, the whole thing is published well. It is peer reviewed, so that itself is proof, and we have the complete raw data, everything is there. Even the raw data we have made available for public to see as part of the publication. Still they wanted proof. Then their concern was that you did not actually discuss this with an Ayurvedic physician. So your findings are wrong. So this was, very lame kind of excuses and very lame reasoning towards an actually peer-reviewed publication. And this is, I don't blame them because they don't know anything about research or clinical methodology or peer review, possibly. So I took it as ignorance from their side and I gave them a reply saying, this is how we do it. Then they asked me regarding samples. They said, you send all the samples to us and let us check it ourselves. So I said, see, this was actually by the Central Council for Research in Ayurvedic Sciences, CCRIS. Okay. They are the watchdog for the Ayush Ministry. So I said, I have already shown you the raw data. Everything is published online. It is there for you to see. I am giving you the raw data which we have analyzed. The original reports was actually shown. Still they were not happy. They called me and said, come to Delhi to talk with the ministry. So I said, okay, we'll have an expert committee meeting where we'll have representations from both sides and we will talk this out. And we can actually make something good out of it. So one should know how to do things in the right way. There will be an advisory committee and things like that. They said, no, you come alone.
Okay.
I said, I'm not coming alone. There's no way I'm coming alone. Either you call my co-authors, senior authors, the journal editor-in-chief. I mean, they are all important people. They are all decided that this should be published, right? So when I said that, no more responses from them.
Okay.
So they stopped it. And actually, I had to block many of these Ayurvedic officers who were actually mailing me.
Okay.
I wouldn't say abusing, but they were harassing me quite a lot. So I stopped taking any email messages from them. They are still blocked on my Gmail, by the way. Even if they're sending me messages, I don't get it. So that was one. Second was, we analyzed a lot of products in that. So we have a lot of private company products. We have a lot of traditional company products also.
Okay.
One private company I would like to actually highlight, I'm not afraid to say it out loud because this is actually happening, is Pankaj Kasturi.
Okay. Yeah.
Pankaj Kasturi markets a drug called OrthoHerb for arthritis, and I mean, unfortunately or unfortunately, one of the patients that we received who had liver injury was actually consuming Pankaj Kasturi's OrthoHerb, and we analyzed that particular drug. The analysis and its details are all available online as part of the supplementary. Nothing is hidden. How we analyzed it, all the methods, everything is there online, and we found out arsenic and lead in that, and we linked probably arsenic is actually a known hepatotoxic agent, known liver toxic agent. So this was actually published, and this actually came out as a separate Facebook post and all. I mean, other people actually wrote about OrthoHerb and everything. I did not do anything, and this was actually published. The MD and CEO of Pankaj Kasturi put an FIR against me and my co-author saying that this is a conspiracy. Like all of us suddenly decided in a round table that we'll have to hit Pankaj Kasturi badly, and we conspired against him and made all this up, cooked up the data and published it. It's a peer-reviewed publication, and cops actually came from Katakada police station,
Okay.
North police station, 3 times to my OPD in between when I was saying, I mean, the police officers were very nice people because they wanted to hear from our side. They sat with us many hours, 2 to 3 times they visited us, and ultimately they understood that this is a scientific publication. There is no conspiracy here. They went and spoke to the district medical officer, the DMO, and he said this is such an important publication. This is an awareness publication. It's important for public health. I don't think there is a conspiracy here. So they just left it. So after that, I am not getting any visits from the police officers, but my lab partners are still getting harassed. Just 2 weeks back, police officers again served them a notice saying that they wanted all the raw analysis data from the lab to show proof that they have the machines to do it and things like that. And this was filed by the same guy. The Pankaj Kasturi MD had actually filed it against the lab again. I mean, this is just wrong. This is very wrong. And actually, we can counterfile it against him. I can actually start a public interest litigation against him, make the government analyze all the products from independent labs and actually make him answer. But I'm not doing it. I'm not doing it. But he is doing this all this kind of harassment with these legalities and everything. And initially we got served a lot of legal notices from a lot of Ayurvedic private organizations, which we actually ignored because they are all fake bombs. They don't explode. So we just understood that it's not worth it answering all of them, and then they died down. And these were actually the 2 major events that has happened. But apart from this, there are these Ayush sympathizers, apologists, who actually don't know what is happening, but they have to give their 2 cents. Yeah. So I have received calls and I have received emails where they have actually threatened to break my legs if I continue work on Ayurvedic drugs. Some have actually mentioned that death is not far away. We'll see you on the roads and things like that. I mean, it's scary. It is scary in a way, but it all turned out to be hollow threats. But I still watch my back.
Yeah. That's true. And there was a specific. There was an article that had to be that was finally retracted. Right?
Yes. So that was my publication on Herbalife.
Okay.
A company called Herbalife manufactures a lot of herbal and dietary supplements. They are a huge multinational company. They have huge markets and sales in the US, Europe and in the Asia. Pacific regions. So I had a patient who had actually taken Herbalife supplements for about a month and a half, almost 2 months, and she developed severe liver injury. She died because of acute liver failure. We could not transplant her on time. And her story was actually published by a particular media outlet known as The Lead. From the patient point of view, from the patient's husband point of view, it's a real story. It's nothing fiction about it. So this was actually published by me in a scientific manner in the Journal of Clinical and Experimental Hepatology as slimming to the death, a case of acute liver failure because of Herbalife products. Now once this was published, obviously it actually got a lot of attention, and the Herbalife company initially sent mails privately from their side towards me saying that we'll have to redo this, reassess this, what is the actual scenario. So I told them this is what is happening. So just like we identify drug induced liver injury, we identify herbal and dietary supplement induced liver injury. There is no, it's very crystal clear how we diagnose it, and we have biopsies also. And what we did was we took herbal and dietary supplements marketed by Herbalife from various places. We analyzed it and we found out a lot of them actually contain heavy metals and bacterial contaminants and possible liver toxic agents. So we linked this theory to our patient. Also, this was not the first time. Herbalife related liver injury and death has been extensively published in literature since 2007 from multiple countries all over the world. So ours is not the first case. And once this came out, Herbalife actually sent us legal notices saying that we'll hold you responsible for defaming us. So I said this is not a defamation, this is a clinical research article, and this is not the first. So they knew that they could not get into our heads like the way they could with other people around me. So what they did was they actually started sending legal notices and scaring the journal editors and the publisher. Yep. And they all fell on their knees. They got scared about these legal threats and then they retracted my paper. So the whole process is actually published. What was happening and what happened is all published by Professor Elizabeth Bick. She runs a very good website on pseudoscience and quackery. And this particular incident was actually published on her website, and it's out there for everyone to read. Because for a research article to be taken down, it has to be either plagiarized or it should have fraudulent data. It should have some unscientific or invalid reasons to come to a conclusion. None of that was actually found, because that particular paper underwent peer review twice, one as part of the original publication and one as part of an investigation. And during the investigation, no major scientific problems were found, and because if it was found, the journal would actually let me know that these scientific issues were found, so you please address these issues. So if I cannot address those issues, then they take it down. That is acceptable. But nothing was found. They just took it down directly, and this was purely because of legal pressure. So this was one time when science was actually brought down by industry pressure, which is actually not good. Yeah. Because in the future, in public health, if we find some issues happening with industries that run herbal and dietary supplements, and we actually want them to be careful so that we safeguard the public interest, it might not happen. Yeah. Because they can actually hide details, they can actually squeeze our hands and change the science. And we should have some kind of framework and transparency to actually fight for science and fight for public health.
Very true.
And that is very important. And this is what I learned from that particular incident.